Hi, and welcome to Humanity RX, where we are sharing stories that highlight the human side of healthcare and bringing you life lessons from the bedside. We are your hosts, Jenny,
Tova,
and Jonathan.
And we're glad you're here. We are very excited to welcome Dr. William Novick here today. Dr. Novick is the founder of the Cardiac Alliance, which is an incredible organization. You have done so much good work. Can you tell the audience a little bit about yourself and your connection to medicine?
Sure. My connection to medicine is I'm a pediatric cardiac surgeon. I hold a endowed chair here at the University of Tennessee in International Child Health and Surgery. And this is my second 501c3 that I've founded since 94. Yes, before some people were born, actually. Our mission is to build pediatric cardiac surgical care programs in countries where either there aren't any, which we've done a few times, or where the deficiency of services, whether it be inadequate number of programs to cover the needs in the country, or whether the program, maybe sometimes the one and only program, has reached a certain plateau and they want to increase the volume of cases. They want to increase the complexity of operations. They want to increase improve their survival rates. So this is what we do. We do this full time. Based in Memphis, Tennessee, we have a skeletal administrative staff, which is why we frequently keep our administrative costs under 6%. From April until December the 21st, we have 15 trips to jam into that time period. So we will be hopscotching around the globe, sometimes overlapping. We have actually enough bodies that we can put two teams out simultaneously. Since 93, when I started doing this initially in Croatia, which at the time had succeeded from Yugoslavia, we've now operated on almost 11,000 children in 36 different countries. And within those countries, we've got programs that we've have run for multiple cities. So the actual institution number is more in the 60s. I do have a wife, believe it or not. She's a former pediatric cardiac intensive care unit nurse. We have 2 boys, and I've got 3 kids from previous marriage that are all, grown up and doing their thing now. So that's sort of it in a nutshell for me.
That's incredible. I mean, you have helped so many children that would otherwise not have that opportunity.
So we have this duality. So there's the warm and fuzzy, what you just talked about. We make the parents happy, the kids happy, the siblings, the grandparents, the whole family's happy. And that's great. Don't get me wrong. But what we do is we will spend multiple years in a country in order to either create or improve their programs with multiple trips per year. And so if we don't leave behind an improved or new functional pediatric cardiac care program, then we actually feel like failures. Now, I realize that, 11,000 kids is a lot of children to operate on, and I get that, and we're proud of that number. It took us 32 years to get to 10,000. The programs that have graduated from us over those years now cumulatively on an annual basis do 10,000 a year. That's where the difference is going to be. That's where you make your difference in really, helping these programs expand or become created and become sustainable and continue to work long after we're gone. And that, I think that's our overarching goal wherever we go. Yes, we're very proud of, operating on these children and making their parents happy. But 1A, build a program that's sustainable. 51%. 1B, make everybody happy, 49%. So it's, a split.
Well, I think that building a sustainable program is going to make many, many people happy in the long run, right? So you leave that behind.
I want to hear about some of your stories, because what you're doing defies politics, religion, it defies everything. You are just going where children need surgery, and it's brought you to some really scary places too. And I feel like you probably have some really intense stories from those experiences.
Let's see. I have two quickies. 1999, March, Belgrade, Yugoslavia. The Yugoslavians were, sort of having a problem with creating genocide for the Kosovars that were still within Yugoslavia, and, NATO and the EU and everybody was sort of tired of it. We had been working in Yugoslavia for a year at that point, and, they announced that they were going to have these peace talks in Paris exactly over the dates of our trip. And I thought, we're totally safe. We'll go in, we'll do all these cases, we'll get out before anything bad happens. Wrong. So we go in, and on, I think it was Wednesday, I don't know, don't hold my feet to the fire on this. You can probably Google the day that the Yugoslavs left the Paris peace talks within the first week. And, we got a call from the embassy on Friday afternoon, U.S. Embassy in Belgrade. Okay, we're evacuating tomorrow and Sunday, and we're taking you with us. And I said, I'm not sure you are. What do you mean you're not sure? You got to get out of here. Yeah, but, come on, really. I'm in a children's hospital. Is the U.S. going to bomb a children's hospital? Is France going to bomb a children's hospital? Well, there's not going to be another opportunity after Sunday morning. I said, okay, tell you what. We have two easy cases today. I'll pull the night crew because the local team is pretty good. We'll have a group dinner. We'll decide who wants to stay, who wants to go. So we had the meeting, and sure enough, all of the ICU nurses with children wanted to go home. No problem. Told them where they were going to be picked up, and that was the end of that. They got picked up by the embassy staff on Saturday morning at 0700 and left the country. We continued to operate. The reason that I wanted to stay is because there were two newborns that I was knowledgeable of that were being transferred to the Children's Hospital over the weekend. They both had a defect which the local team had never performed independently. And, it's a moderately complicated operation, but, I knew that they would not be comfortable doing it. So we stayed. There were 9 of us that stayed. And on Monday and Tuesday, we listened to this Western-leaning rock and roll station, which is broadcast. The DJs actually speak in English. And they kept pulling off this fake air raid signal. And by Wednesday, on the start of the second one of these newborn cases, we did both of them on Wednesday. I'd about had it, The sun had started to go down, and I looked up at my anesthesia colleague from Belgrade, and I said, are you tired of this? He goes, well, yeah, I am. And about 15 minutes after the sun goes down, and I looked over the screen at him, and I said, okay, turn off the radio. I've had it. He goes, no, that's a real air raid signal. And 30 seconds later, off in the distance, you hear the first thunder. But there were no clouds in the sky that day when the sun went down. And the thunder got closer and closer, and sure enough, NATO had started bombing Belgrade. So I looked up from the operation. We're right in the middle of the most complicated part, and I said to our Serbian colleagues, look, a lot of your countrymen are going to die tonight, but this child on the table is not going to die. And I am going to make sure we get the kid off the table. So as soon as we're through and the baby's off the bypass machine and everything's stable, you guys can all go to your families. And they looked up into the person one by one. They said, we're not going anywhere until this child's settled in the ICU. Yeah. So 21 years later, I get an email from the mother telling me how proud she was that I did not desert her child that night. And he had just celebrated his 21st birthday. And boy, he would, sure like to meet the man that stayed that night while the bombs were falling around him and saved his life. "30 years later, not quite to the day, but close, in May of 2014, we're in Benghazi, Libya. Now, they had gone through the Gaddafi revolution. Everybody was excited, but they held elections in February of 2014, and the transitory, government was not happy with the results because the Islamists did not win very many seats in the parliament. So they started a campaign against them, and here we are in Benghazi in May, and Islamists are on one side of the hospital, the secularists are on the other side of the hospital, and the civil war started. And so for 4 nights, we watched missiles and rockets and mortars go over the children's hospital. Well, the gigantic 2,500-bed hospital with 3 7-story towers and connecting bridges, and it takes up an entire square city block. And fortunately for us, nothing fell on the hospital. We'd stopped operating the first day that the bombings and conflict started, and they were trying to figure out how are you going to get you out of here. The airport's been bombed, so you're not going there. And it's also controlled by the Islamists, by the way. And we need to get you to another city. But we've got to work out a ceasefire between the warring parties, because the one road that we need to get you on to take you to the next city that has an airport is being contested by both sides. Oh my God. Okay, so everybody is told to pack their bag, live out of your bag, because you're going to be given 30 minutes notice that we have to be in the cars downstairs in the basement. We don't want anybody seeing you leaving the hospital. So you're leaving from the warehouse area in the basement. So the call finally came, and we were all ready, and downstairs we go. We jumped in these, one SUV with blacked out windows except for the windshield, and then a panel van that had no windows except for the windshield. And off we went, and we didn't have any trouble. We stopped for no red lights. We drove on the sidewalk. Okay. we drove one way the wrong way to avoid stopping. I mean, it was no holds barred. These guys were told, do not stop under any circumstance. And we got out and got to the city, and the next morning we got up and went to that airport. And, the heartwarming part of this is that here's this collection of Westerners obviously standing out with all the Libyans that are collecting outside the airport because they hadn't actually opened the doors yet. I go over to a little kiosk to get some coffee. I told everybody, I said, stay together. Right? We don't know who's who here. Stay together. I go to the kiosk, and I get tapped on the shoulder. And I turn around, and there's an elderly guy standing there. He said, are you Dr. Novick? I said, yeah. He says, is that your team over there? Yeah. He said, take your coffee and go over there, and then I will bring coffee to everybody else. My wives are going to come and talk to your ladies, because if anybody needs to go to the bathroom, they're going with my women to protect them. And nothing's going to happen to you guys. Nobody's even going to get close to you. So just, don't worry about anything. We sat with them for 6 hours. They were on the same flight as us, flying to Tripoli, and we got out later that afternoon out of Tripoli to Istanbul and got home. So those are my 2 most interesting stories.
I have a question. Do you remember kind of like the moment that, I guess we can say, was it 92, 93 that you started this? Like what was the concept where when did it first come to you, or maybe it was a colleague that talked to you about it, or
Yeah, very interesting question. And there is a very significant point in time. So I went to the University of Alabama for my cardiac surgical training and said, wow, they even do heart surgery in Alabama. And way back in the dark ages of the 80s, This was one of the 3 top places in the world for pediatric heart surgery. Alabama stole from Mayo Clinic, probably the best pediatric heart surgeon in the world at the time, and brought him down there in the 60s, late 60s. So we're seeing all these kids come through from different countries. The thing that amazed me about this, especially in the 90s, when I became the congenital fellow, I had to examine every child, talk to all the parents, et cetera, et cetera. And, we'd have rich Iranians coming in and rich Italians, rich Japanese with attaché cases with bundles of $100 bills. And we'd have other people coming in with clothes on their backs and a plastic sack with their few remaining things in there. The little girl that came from Nigeria with her mom, they were from the Biafra region. I don't know if you guys know anything about the Biafran Civil War. And so they're from a very oppressed region, and they both spoke English and native. They're native Igbo. And the diagnosis that they came with was one that the university was world famous for fixing. I examined her, and I don't hear the usual sounds in her chest for that diagnosis. So she was supposed to be on a surgical schedule the next day, but that was presuming that she actually had what she's supposed to have. So we canceled her, got her a cast, and she had very complex defect. Unfortunately, she had permanently scarred, as a result of 12 years of having this, 60% of her lung tissue, which meant she couldn't have a complete repair because the heart would fail relatively quickly. So we did what's called a unifocalization and shunt operation on her, made her look better. Her saturations in her blood came up, made her feel a little better because now she had some oxygen in her bloodstream. So I went to discharge her, and I had to, give the whole spiel to the mom. And the mom was unbelievably appreciative and thankful that we had done what we had done for her daughter. I was really confused. I said, well, wait a minute. How can that be? You came over here for a Cadillac operation and you ended up getting a Yugo. How can you be happy? She said, because you've given my daughter additional years in her life that she otherwise might not have had. She feels better. So how can I not be appreciative of this? I left the room with tears running down my eyes. And for the next 6 weeks, every night I woke up about 2 o'clock in the morning with a nightmare that I was chasing this little girl out on the open savannah. And just as I'm about to grab her, she falls into an abyss and she's gone. So I had 2 friends from Columbia that had come up to train at Alabama for what we call super fellowships. They'd already finished their heart surgery program, training programs in Columbia. They wanted more congenital work, so they came to Alabama. I guess it was a Friday at the end of maybe 6 weeks of this damn nightmare. Every single night. Weekends didn't matter. So I'm not getting much sleep, and I turned into a grizzly bear instead of a teaching bear. And they noticed, and they said, we're taking you out for beers. What is going on with you? So I told them, and they said, okay, we thought that might be the case because you always get attached to these kids that can't be fixed. If it's too late for them, it's terrible. So, well, we want you to come to Bogota when we open our new programs. One's going to be at a public hospital, one at a private hospital. I said, all right, let me talk to the boss on Monday. And I did, and he said, you can go after your attitude adjustment, because you are, everybody has noticed this big change in Bill Novick. So the nightmares stopped actually on Friday night. That Friday night, I did not have a nightmare after agreeing with him to go to Bogota. And 2 months later, I got a page from the office, and senior secretary says, the boss wants to talk to you because he's ready for you to go. So then I went, and it was fascinating, really fascinating for me. And I spent 2 weeks, 1 week in each place, gave lectures on the middle Saturday, went out to a friend's ranch in the foothills of the Andes, rode horses on Sunday, came home, and the boss called me in the office, and I thought I was in trouble. He said, okay, look, you made a great impression. You represented the university very well. Everybody's very happy with you. They want to know when you're coming back. I said, well, I got to finish my congenital fellowship and da-da-da. Before you leave, I want to say one thing to you. And I'm thinking, oh, boy, here comes the trouble, right? He's waiting. He'd give me all this good stuff. Now he's going to kill me. Do not let these humanitarian work overcome your life. the one piece of advice Albert D. Pacifico gave me that I never listened to. You know? So
Are you glad you listened to it?
Yeah, well, I don't think I listened to him very well because, I mean, in 2001, when the chair was endowed, I stopped operating in the United States. Here in Memphis, I stopped operating in the Children's Hospital in July of 2001 and went full time to doing this. And this is what I do all over the world now. And he told me not to let that happen. And oops.
Why do you think he didn't want it to happen?
Okay, so the Alabama residency program, it was very strange. You got identified relatively early in the game as to what kind of a surgeon you were going to end up being. And he had plucked me out to be one of those guys that was going to rise to great heights in the academic world and blah, blah, blah. And so he didn't want me fiddling around with this. He wanted me to go through the academic pathway and become the professor of blah, blah, blah at the University of so-and-so. Well, I did, but not the type of professor that he wanted. I'm the professor that leaves the country, not the one that stays. Well, I looked at this really very early in the game. We were up to making about 8 trips a year in 1996. I had people asking me all the time, come on, what are you doing? And I had a lot of colleagues around the country, and I thought to myself, this is nuts. I'm fortunate. I'm one of 2 guys. I get to do 150 cases a year. The guys that I'm training, they're not going to do kids. And there are enough pediatric heart surgeons in the U.S. Where would my impact be greater? Where could I make a difference after having been to Bogota and now building the trip level up 2, 4, 8? So I made the conscious decision then that if I could find a way to do this full time, that's what I would do. And an extremely rich lady in the city of Philadelphia decided after she read my book that she liked what I did. My former boss up there was a dear friend of hers. He made a suggestion to her, and she agreed to it. She sent the University of Tennessee $3 million to endow a chair so I could do this full time. So,
what a lady.
Yeah, I started doing this when I was 39, and last month, or month before last, January, I turned 71, and I'm still doing it. I've got one more child to get out the door. Okay. He's a senior in high school right now, and I promised him that I would stick around and work like a dog for him until he graduated from the university. But I said, you got 4 years. There's no slow-mo in this deal. And if you can do it in 3, I would really appreciate it. So that was the tipping point for me. This one little girl. I mean, we'd already operated on Iranian kids and Italian kids and Japanese kids and German kids. And they all were well off, or they came with adequate funds. And we'd done some Central American kids, but they were really simple cases. Just what we call chip shots. They spend 1 day in the ICU. They're 2 days on the floor. They go to the hotel, they come back on post-op day 7 for the check, boom, put them on a plane, they go home. But this child could have been fixed if it had been seen when she was 6 months old or 1 year old or even 18 months old. But 12 years after she's ruined 60% of her lungs, so she's not repairable. And I knew that, and I also know about her death, because I got called by the charitable group that brought her in about 2 weeks after she died, right after her 21st birthday. She made it to 21. Her mom got 9 years. I mean, this little girl was, she's African, so she's black, but she was purple. Her blood saturation was 42%. And you run, 99 to 100 if you don't live in Denver or somewhere like that. So she was in big trouble. And, the fact that we could help her at all was great, but it just really pained me that she came so late and she couldn't have a operation that would completely fix her. Yeah, she would have needed more operations down the road. This particular defect is something that needs multiple interventions throughout adolescence and adulthood, until you finally reach the point where, okay, I don't need anything else done. But that's typically, in your mid to late 20s. Went up to the nurse's station, and the head nurse for the floor The tears are running down my eyes. She says, "Oh, what's wrong with the Russian bear? He having a little trouble with the fact that he can't help all these kids around the world?" I looked up at her and I said, "No, but I'm going to figure out a way to do it sooner or later." She gave me a pat on the back and said, "You are absolutely incorrigible, Bill Novick."
If you're speaking to healthcare providers, locally around the world, and what would be your what we call our prescription for humanity for them? What would be your takeaway for them?
My takeaway for everybody that's in the healthcare profession is this isn't just a job. All right, should be a calling. If you look at it just as a job, it's the wrong profession for you. We are constantly, or should constantly be reminded to stoop to help those individuals, okay, that are in positions that need our help, regardless of their ability to pay, regardless of where they are in the world. Stoop to help your fellow man. I don't know where that came from in me. I guess it's just developed over time. As a child, I was always bigger than most kids. I mean, I'm 6'6", 275. And back in the day, before I was 275, the bullies had to deal with me if they were bullying somebody. So I've always sort of tried to defend those less fortunate or those that are being oppressed. I mean, I grew up in a household in Alabama that was about as non-racist as you can get, was nurtured by a mammy. You know what a mammy is? A mammy is a black lady that takes care of you from the time you're delivered until you become an adolescent. So I always had respect for everybody that felt like they were being oppressed or being bullied. And I got a lot of it from the people that I grew up around in Alabama, and it just stuck with me, I guess.
I hope that lesson sticks with many people.
Well, I hope so too. I mean, the world would be a much better place if everybody would just take a little time every day and stoop to help somebody less fortunate. Yeah, the rewards are amazing.
I agree.
Really?
And I think it's so profound that you talk about the little girl who kind of started everything, because I think for a lot of us healthcare professionals, we have that person or those people that we can't let them go. They just stay with us. But a lot of times they encourage great things. So
yeah, so there's, I've got connections all over the U.S., and we ended up spending the last 5 years making a documentary of our work in conflict zones. So it's been submitted to a number of film festivals. The first one up is going to be Tribeca. I don't know. We're going to find out. But this little girl's prominent in the movie. I tell the story, and producers got a little carried away. It's out of, and I hope it's out soon.
What's the name
of the movie?
The name of it? Get ready. Tiny Hearts.
Oh.
Yeah.
I thought it was going to be Dr. No.
Well, so it was originally named Dr. No.
Really?
Okay? Right.
Oh, no, because this was before we started recording, but they call you that because you can't say no.
That's right. But our marketing and PR people that are helping us free of charge said, no, we think Tiny Hearts is better. And you know what? I agree with them. I really do. It's much better.
I need to see it.
If the audience wants to find out more about how they can support your cause, how can they find out more about the Cardiac Alliance?
I think you go to the webpage, you just Google us, Cardiac Alliance, and we pop right up, or normally we do. If you want to put in Novick Cardiac Alliance, we'll pop up even more quickly. But we have volunteer opportunities. We have, obviously, funding opportunities. Flying 16 people on the other side of the world is not cheap. So we always need supporters. There's no question about it. But volunteers are critically important for our mission as well, because we do have a full-time staff of people that I've trained over the years that work for us, 2 surgeons, anesthesia, everybody. But the whole team is not made up of paid staff. So only about 40% of the team is paid staff, and we need a lot of volunteers to fill in the gaps. We're making a trip to Bishkek in May. Get ready. 2 separate hospitals we're going to be operating in the same city, thank God, for 1 month. And the team is 28 individuals. Yeah. Yeah, and we'll probably operate on somewhere in the neighborhood of 80 to 90 kids in a month.
Wow.
Incredible. Well, Novick, thank you so much. I encourage everybody to check out cardiac-alliance.org.
Thank you so much for doing this. Really appreciate it.
You. We appreciate you and your work.
Yes, thank you for everything you do. Thank you for listening to Humanity RX. We hope today's conversation gave you something to think about and maybe even feel a little more connected to the human experience. To find out more about our guest, please find more information in our show notes. Humanity RX is created, written, and produced by the three of us, Jenny, Tova, and Jonathan. If you enjoyed this episode, we'd love it if you subscribed, left a review, or shared it with someone who needs a little dose of humanity. You can find us on Instagram at HumanityRxPod or LinkedIn at HumanityRx. Until next time, be good to yourselves and each other.